All right. Welcome everyone to our Elbert County Board of Health COVID-19 update for Wednesday, June 3rd. I will turn it over to the chair. Go ahead, Chris. Chris, are you waiting for me or are you waiting for Amanda? He looks like he's frozen. Dwayne, can you hear me?
Yes.
Okay. Chris, can you hear me? Well, then why don't I just go ahead and Chris may have his, oh, Sam's going to go across. Oh, there you go.
I just realized I saw mouths moving and my
Yeah.
headset was turned off.
There you go. Well, then there you go. I'm turning it over to you.
All righty. Thank you so much, Eileen. So it's noon. This is a public health, Board of Health update, Board of Health meeting. So if we could, time is 12:05. I guess we'll do a brief pledge of allegiance and then call the roll. If you could join me and do whatever flag you have present. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you much. Amanda, if you could call the roll, please.
Commissioner Richardson.
Here.
Commissioner Thayer.
Here.
Commissioner Pettit.
Here. All righty. Also joining us, for those that might be listening but can't see, the County Manager Sam Elbert and our Public Health Administrator Dwayne Smith. With that, Dwayne, I'd turn it over to you. We just have a couple of brief things today to give an update on where we're at within the county and then discuss a little bit the variance that was just received. So.
Thank you, Commissioner. Good afternoon, commissioners, staff, and residents that are watching. Dwayne Smith, Public Health Administrator for Elbert County. I'm going to provide an update on, and do I have control, Eileen, or do you need to advance for me?
No, I'll need to go ahead. So I'll just try to track your conversation.
Yeah. First slide, please. So while that's coming up, I'm going to provide an update on the status of cases of COVID-19 in Elbert County, and also an update on the variance to the stay-at-home orders that Elbert County leadership submitted to CDPHE. Next slide, please. So I think perhaps one of the most informative things we can share today, and thank you to Commissioner Richardson for tracking this down in the depths of the CDPHE website, of their COVID-19 website. To date, we didn't have a good idea, or really any idea, of how many Elbert County residents had been tested for COVID-19. So as you can see by the statewide map here, Elbert County residents or 816 Elbert County residents have been tested thus far. Again, thinking about a countywide population of about 28,500 residents. So I think the math on that is somewhere in the neighborhood of 6.5% to date. 6.5% of county residents have been tested. For context, this was a pleasant surprise to me. If I had to venture a guess, I would have guessed it would not have been this many. So among the 64 Colorado counties, our county residents have been tested. More than not quite 30, I think, a quick count among in comparison to other counties around the state. So again, my goal that I hopefully stated in a prior conversation, I'd like to have at least 10% of the county residents tested by the end of the calendar year. And this is a very good start. So hopefully folks will continue to avail themselves of testing resources. We haven't quite yet reached protocols for asymptomatic testing or testing of individuals that have not yet experienced those COVID-19 symptoms. That will come eventually, and we'll certainly make folks aware of that when that announcement, with an announcement when that is ready to happen. So our partnership with, you can stay on this slide, Eileen, or the next one. Our partnership with Peak Vista Community Health Center, to date, they have tested approximately 50 folks through their resource there in Kiowa. Again, we want to make sure that folks know that there is a testing location in Elbert County. They do not need to travel outside the county anymore to get tested. So next slide, please. This is looking at the running count of confirmed cases of COVID-19 since testing began among Elbert County residents in mid-March or so. Currently, we are at 55 cases since the inception of the epidemic. One note that folks may, if they're tracking on the CDPHE website, we are aware of 2 additional cases above what CDPHE lists. So in other words, CDPHE at last check the other day, I think Monday, stated that there were 53 cases in Elbert County. We count 55. Those extra 2 cases we believe are Elbert County residents that live in the 80138 Parker zip code, Parker postal zip code, that we are inferring that when someone looks at that and sees that that's a Parker zip code, that they're assigning those cases to Douglas County. And we have had those conversations with CDPHE. So we are tracking 2 more than the state is showing. Next slide, please. So those that have recovered from infections of COVID-19, that's what this graph shows, along with the cumulative number of cases. And I believe that the next slide, we'll get to, one of the subsequent slides, we'll get to what we estimate are current cases. But how do we identify who we think is currently experiencing or has been infected and the virus is running its course? We basically look at our calendar and the number of confirmed cases and go back 14 days. It is not an exact science. It's a pretty accurate understanding, however, of who is currently infected. And of course, those folks have been issued isolation orders to remain in their residence. For tracking purposes prospectively, we have a contact tracer that will be coming on board this week, at least in the initial stages, to begin learning processes and protocols for contact tracing. And as we ease restrictions over time in the ensuing weeks and months, we'll need a dedicated contact tracer to conduct a more robust investigation of infected folks and where they may have been to try to figure out potential locations or sources of exposure. We generally do not have, I don't think we've had more than 2 cases reported in a couple days. Generally, it's 1 here, 1 the next day. We'll go a day or 2 without a case. So just as a matter or by way of sharing, we check that every morning. the disease registry, the state reporting system is checked first thing in the morning, and then I report that out and we add to the numbers. But as you can see from this graph, we haven't had any significant spikes. Those really small spikes where we've had more than a couple cases, looking back at this graph on the 2nd of May and the 4th of May, and maybe on the 16th of May, those are not necessarily cases that occurred at the same time. It's just when they were reported and that information came back through the registry. So, okay, next slide, please. So where are the cases of confirmed current infections and past infections, again, since the inception of our tracking? The lion's share of them are in the northwest corner of the county. Obviously, the population base predominates in that geography. The septant on the map underneath that, where it lists 8 cases, I believe most of those are Elizabeth cases in the 801, Greater Elizabeth, I should say, 80107 zip code. And the 2 cases in the north central location of the map are Deer Trail mailing addresses, but they are Elbert County residents, and they are northeast of Kiowa. And on the eastern side of the county and the central southern part of the county, right where the 86 highway marker is on this map, no cases to report. So generally we're doing good. Elbert County residents are doing good mitigating community transmission of the virus. We continue to see a spouse infected, and then subsequently everyone else in the house is tested, and another spouse or an older teenager on occasion has come back with a positive case. Next slide, please. Our presumed active cases of the virus, in other words, those people that are infected and the virus is running its course, we believe there are 7 that are currently running their course, 7 individuals. And again, that is related to the 14-day window in which the virus is presumed to be active based on what we know of the science, and that person in that 14 days, somewhere in that 14 days, can be shedding the virus and transmitting it to others. Generally speaking, what scientists have found is when someone is infected, if that's day 1, they're typically not seeing symptoms until approximately day 5, and that's when they begin feeling unwell. And in different folks, that manifests itself in different fashion, some with more severe symptoms, some with less severe symptoms, and even some with no symptoms at all. So there's easily or typically a 5-day lag before someone begin feeling the effects of the infection. And that is when the body's immune system is ramping up its response to fight the virus. Next slide, please. So late last Friday afternoon, we received notification via email from CDPHE that our second request for variance from a partial variance request from certain components of the Safer at Home executive order and accompanying public health order, we received notification that it had been approved. So what do we ask for? We requested an increase in the number of folks that could gather across the county from the executive order limit of 10 up to 25 countywide, up to 50 folks gathering in larger areas, and under certain conditions, meaning that the requesting entity has coordinated a request with myself or someone in the health department, and we've reviewed their plans and things like that, and typically done a walkthrough site visit. Under certain conditions, we'll grant up to 100 people to gather or assemble for an event or church or something of that nature. One of the other things we requested are opening of gyms, dance studios, and gymnastics facilities. That was also approved. We had also requested local decision-making capabilities to address restaurants, small dining establishments, again, not to exceed the state's relief on that, where occupancy states requires no more than 50% of the occupancy for the restaurant and not to exceed 50 people in total. A lot of restaurants and dining facilities have taken creative approaches, expanding their footprint for their dining space, which is great. We just want to make sure that we are aware of what they're doing, that anything that they are altering in their dining footprint does not inhibit fire or life safety protection measures. So it's important that they coordinate with their local fire protection district to make sure that any changes they make are not creating any hazards within the facility. And then related to that, we requested that liquor licenses can be expanded to outdoor dining areas with no additional requirements or modifications needed from the state. And that has been approved. So this is the initial phase of the easing. Please keep in mind that social distancing requirements are still in effect. That will be with us for a long time, no matter the venue or activity. We are not mandating face coverings, but we certainly encourage folks to do that. That has a protective factor when people are in tighter quarters. And if anyone has any questions, they can certainly check in with myself or a member of our staff here at the health department with any questions and guidance. In some cases, we will need to defer to state guidance or regulations. I know I had a conversation with a spa this morning and some estheticians. They had, we found out, better guidance from the Department of Regulatory Affairs at the state level than I was able to provide. So I simply said, please defer to what Dora is telling you on how to coordinate interactions with patrons of the business. Next slide, please. Okay, so it's important to know and plan for that as restrictions are eased locally, including current and subsequent granting of local variances, we will see an increased number of folks turn up with infections or an increased number of cases. We hope that that number is small. We hope that that number is manageable and doesn't tax or overburden our local ability to respond to the infection, as well as the abilities of our healthcare partners in other neighboring counties. Per guidance in the variance from CDPHE, our threshold for ceasing any provisions in local variances is 27 confirmed cases of the virus over a 2-week period. That's a rolling 2-week period. I can't predict where we're going to be. June is going to be a very telling initial first glimpse of where we'll be for the rest of the year. Think of it as a litmus test because we've eased a lot of things. We know that there are equestrian events, horse events, that will be convening. Spectator sports are still on hold, but these particular equestrian events, if it's horse show or pole bending or barrel racing or something like that, we're generally okay with that because those types of events lend themselves to social distancing anyways. We just like to see the facility where it's taking place, so that we can do a walkthrough and have a conversation with the event organizers, and covering things like having plenty of hand sanitizer and encouraging participants and their parents to wear face coverings, and all the minutia that goes into planning those. Folks just have a lot of questions, and I have been sharing kind of anecdotally, when these executive orders and public health orders come down from the state level, they typically cover about 80%, give or take, of the scenarios that we can think of. It's the other 20% that are more localized considerations that we need to talk through and sometimes troubleshoot for and find a solution so that we can accommodate these things. Next slide, please. So what can you do? Again, maintaining social distance. Keep that minimum 6 feet away from other folks. Remembering that the virus is primarily spread through respiratory droplets produced when an infected person coughs or sneezes. There is some evidence that if you are having a longer conversation with someone in close proximity, typically more than 10 minutes and within 6 feet or so, that the potential exists, albeit reduced, that an infected person could infect the person they're speaking with. So maybe a good rule of thumb is to limit the length of your conversations in close proximity to other folks when you are out and about. Next slide, please, Eileen. Another thing you can do is wear face coverings or a mask. That helps slow the spread of the virus. It is one of the tried and true measures we found in preventing the spread of the virus by those who are asymptomatic and don't know it, may be infected with the virus and have no idea that they may be potentially infecting their neighbor or a relative or someone else. The masks are super important when you're out in public. If you work in an office by yourself, certainly you can take it off. You don't need to wear it at home. You don't need to wear it amongst your family if they are family under the same household. So it's not a 24/7 thing, but it does have a significant protective effect. And when we stack the layers of protection along with social distancing and limiting our interactions to those things that are mostly necessary, whether that be outdoor recreation now that's allowed under the most recent public health order, whatever it is, that helps protect not only your friends and neighbors, but the larger community as a whole. And the less the virus is circulating, the easier it will be and quicker it will be to when we can get back to increasing normalcy in our daily and weekly routines. Next slide, please. There's my contact information. Please connect with me if you have any questions. And just in summation, I want to share that the overarching goals we have in Elbert County are to slow down the spread of the virus so that we don't overburden the healthcare safety net and our local ability to respond to the virus. We also want to be in a position to get kids back to school in the fall or in August. And we want to prevent having to regress either locally or be told by the state that we need to go back to more restrictive measures. Thanks very much, and I'll turn it back to Commissioner Richardson.
Thanks, Dwayne. Appreciate the update. I'm glad to see the numbers are still steady and low. appreciate the work everybody put in to get the supplement to the waiver in. I think that gives us some tremendous flexibility to address safely quite a few local things now. I don't think anybody's had a chance to digest it. The CDPHE put out their 5th amended public health order. It was dated yesterday. I don't think it popped up until today. There's some things in it that take effect on the 4th that I think a lot of people will be interested in. Opening of playgrounds. It does address, just in a brief look through, league sports with some other conditions. So I think we're going to need to take a look through it, see if there are things that still need to be addressed locally. I'd be interested in the discussion you had with the local estheticians. I know I did look briefly at that. They're still barred from any services to a patron that requires the patron to remove their mask. So if there is some accommodation with face shields and masks that can be made, I think that's one that we should go after. But with that, I'd actually turn it over to my fellow Board of Health members if there's any questions or comments you guys have. Seeing none. No, I appreciate the update. That was pretty much the nature of today's call and meeting. I don't think we have any specific guidance at this point. Again, the new public health order is about 45 pages long, so to try to get through it and see if there's others, if there are items that we need to request a supplemental to our waiver. I somewhat broken the code, or at least we've got the template for our own down. So try to get something in this week if there are things that we need to waive or request waiver for. So if there aren't any
Commissioner Richards, let me just interrupt. Commissioner Thayer leaned forward. I just wanted to make sure that he didn't have any questions and needs some help unmuting, or if he's good. You just.
No, I'm fine.
Good. Fantastic. Okay.
Well,
and in answer to your question, yes, we have been live on YouTube Live.
Thank you.
And so the meeting will be available there after we're done for anybody to view.
All righty. Sounds good. I guess if there is no other business, I'd take a motion to adjourn. Okay. I can read Rick's lips. I know that was a motion to adjourn and I heard him through the wall. So Grant, do I have a second?
You have a second.
Okay, we have a motion and a second to adjourn. All in favor, please say aye.
Aye.
Aye. All righty. I see 3 ayes. Motion carries. We're adjourned. Thank you, everyone.
You all.
Thank you, Dwayne. Yes.